What is COVID-19? How does it infect people and what are the symptoms? How can you manage COVID-19 at home and when do you need to seek urgent medical attention? Join me in this video to find out a bit more. Hello everyone, welcome back to my channel. I'm Dr. Geraldine Opara, currently a GP trainee in the UK, and if you're new to my channel, welcome. And in my channel I talk about wellness, productivity and growth, and in today's video I will be sharing with you the important things you need to know about COVID-19 and how you can manage some of your symptoms at home. Please do not forget to like, comment and subscribe, and also hit that notification button so you'll be notified anytime I post a new video. COVID-19 is the abbreviation for Coronavirus Disease 2019. CO represents corona, VI represents virus, D represents disease, and 19 represents the year it was first identified in Wuhan, China. COVID-19 belongs to the large family of coronaviruses, and it's important to know that coronavirus has been around for a while now and it can affect both animals and humans. There are essentially 7 types of human coronaviruses which can cause various types of illnesses, ranging from mild respiratory illnesses, example mild cough, to severe respiratory illnesses which can even cause death. Some examples of common disease outbreaks which were caused by coronavirus include the SARS-CoV-1, which is the virus that causes SARS, severe acute respiratory syndrome, and the MERS-CoV, a virus that causes MERS, Middle East respiratory syndrome. So what are the symptoms of COVID-19? So some people can have COVID-19 and they will appear not to have any symptoms. Other people, on the other hand, can present with various symptoms which include but are not limited to the following. So they could have dry cough, fever, body aches and pains, general body weakness, feeling cold, headache, and sore throat. Other symptoms could include poor appetite, diarrhea, vomiting, tummy discomfort, and loss of sense of smell and taste. There have also been reports of people having skin rashes and a stroke. Now, how can one contract COVID-19? So COVID-19 is usually spread from an infected person to the other. It can be transmitted when an infected person talks, coughs, or sneezes. Also, you can be infected when you are less than 6 feet or approximately less than 2 meters away from a person who has the virus, and that is why social distancing is encouraged. You can also contract COVID-19 by touching objects that have the virus on them. This happens when an infected person touches his or her contaminated hands on an object, and you then touch this object yourself and then touch your mouth or your nose or your eyes. So how is COVID-19 managed? So COVID-19 has generally been classified as asymptomatic, mild, moderate, severe, and critical. But for the basis of this particular video, I will be talking about how patients who have the mild form of COVID-19 can manage their symptoms at home if they are stable enough to do so. So what do you expect to have when you have the mild condition of COVID-19? So you may have new and continuous dry cough, which is mild, and you shouldn't really struggle with your breathing when you are doing normal activities. Sometimes you may not even have a cough. Another symptom you may have is fever, but in the mild case this should not be more than 37.7 degrees centigrade or more than 100 degrees Fahrenheit. You may also notice that you may have lost your sense of taste or smell, and you may have some body ache, headache, and you may start feeling a bit tired. You could also have sore throat or runny nose, but this is not common, but you could still have it. You are still able to eat your meals even though your sense of smell and taste may be affected. So effectively you have a decent appetite, so eat healthy foods. However, there are certain groups of patients that even when they have a mild case of COVID-19, they can easily get worse, and therefore they should seek medical advice if they have mild disease. Now, these are people that are above 70 years, those that have problem with their organs such as heart or lung. Another group of these patients are those that are on steroids or medications that suppress their immune system, and also those that have had a solid organ transplant. This list is not exhaustive, but it throws more light on things. But if you are in doubt, always seek medical advice. So what ways can you manage your COVID-19 at home if you have a mild disease? Firstly, you have to self-isolate and maintain good sanitization. If you have high temperature, take plenty of fluids, especially water, to keep you well hydrated. So why do you need to take plenty of water when you have fever? I will explain. So this is because when you have fever, your body works more to meet up with the demands that your body needs to keep you alive, and this is called metabolism. So secondly, when you have fever, you lose water from your skin because your body is trying to cool itself down, and this is your body's natural response. But when your body is doing this, you eventually lose water, and this dries you up, leading to dehydration. So this will make you feel more unwell and even tired. Therefore, it's important that you drink plenty of fluids to rehydrate yourself and also provide your system with what it needs to function properly. You can also take medications like paracetamol to help lower your temperature when you've got fever. So secondly, take some rest. So rest is very important because when you have an infection, your body metabolism is higher as your body is working hard to fight the infection. When you rest, you spend less physical energy, which means that your body system has more energy to fight the disease. Also, rest and sleep helps the body's immune system to work at its best to fight any infection. Therefore, having adequate rest is important for you to recover. Another symptom is cough. So how do you deal with cough? Even though a majority of people with COVID-19 have dry cough, a smaller percentage of people do have wet cough. So in this case, try not to sleep on your back. You can try raising your head and neck a little bit, not too much so that your neck doesn't hurt. This is because sleeping on your back can cause mucus to accumulate in your throat, which will trigger more cough. So another thing that can help you with your cough is taking fluids. So fluids will not only help to soothe your throat, it will also help to loosen the mucus, assuming you have a wet cough, therefore making your cough out more phlegm and also clear your airways. Now, drinking warm beverages will also help. So you could also try warm soup if you can. And lozenges and honey are also good for soothing cough. But please do not give honey to children less than 12 months, as honey contains bacteria that can produce substances that can affect the intestines of your baby, thereby making them sick. Another important symptom is diarrhea and vomiting. So if you have diarrhea and vomiting, continue to stay rehydrated, drink plenty of fluids, ensure that you rest and avoid foods that may upset your tummy even more. More especially, make sure you sanitize your hands frequently. If you can afford to have your own toilet and bathroom, use it only for yourself so you don't spread the virus around. So the next symptom is breathlessness. So if you have or if you feel breathless, the first and the most important thing is do not panic. I know this may be frightening, but staying relaxed is very essential. Secondly, do not turn the fan on as it will spread the virus a lot more. Instead, open up your windows to allow fresh air to come in. So when sitting, do not slouch. Sit up to allow more air to enter your lungs and also provide more space within your chest for your lungs to expand while you're breathing. And when you are sitting, sit upright, relax your shoulders. You could also support yourself by placing your hands on your thighs so you feel more comfortable. Breathe in through your nose and out through your pursed lips, like so. Also remember to plan your activities. Do not do strenuous activities, as this may make you run out of breath. Take it one day at a time. So you could try this at home and see how you feel about it. However, if you notice that you're having worsening trouble with your breathing, you are struggling to talk in full sentences, and you are now running high temperatures, or you start having rashes on your skin that does not disappear when you roll glass over it, and we call that the tumbler test, please do seek urgent medical attention. Also, if you have chest pain or your chest feels tight or you start coughing up blood, you feel confused, or people around you think you're confused, or you're not eating and drinking well and you're not passing urine as much as you should, or you feel drowsy or faint, your lips are turning blue, or you are just worried that you're becoming more unwell, then you need to seek urgent medical help. please do not stay at home. So I hope this video has helped you understand a bit more about COVID-19 and how you can take care of yourself at home. Remember to self-isolate and sanitize. Thank you guys for watching. I hope you found this video helpful. Do drop me a comment below and also click the like and the subscribe button, and don't forget to hit the notification bell so you will be notified anytime I upload new videos. See you in my next video. Bye now.